Poor sleep alone won't kill you, but what you do in the first 30 seconds after waking up just might. There is one specific morning habit that the majority of Americans over 60 repeat without a second thought, every single day. And recent research suggests it raises the risk of a fatal cardiac event by as much as 40%. We're not talking about smoking or a bad diet. This is something you do before your feet even hit the floor. And the scariest part? Your doctor has most likely never brought it up. Stay with me until the end because the number one protective habit I'll share today is so straightforward, so completely free, that a major study published in the Journal of the American Medical Association found it cut early morning cardiac events by up to 62% in adults over 60. And yet almost nobody does it right, or at all. My name is Eric Sinat. I've spent over 2 decades watching hearts give out, and just as long watching the same avoidable morning sequence repeat itself in patients who felt perfectly fine the night before. Today, that cycle stops with you. Before I name the habit, you need to understand what's actually happening inside your body the moment you begin to wake up, because without that context, the danger won't fully make sense. While you sleep, your body operates in a kind of low-power state. Your heart rate slows, blood pressure drops, and your nervous system goes quiet. It's the only true rest your heart gets in an entire 24-hour cycle. But here's what most people never learn. The instant your brain starts waking up, even before your eyes open, even before your alarm sounds, your body begins flooding your bloodstream with 2 stress hormones, cortisol and adrenaline. They start climbing roughly 60 minutes before you're fully conscious. By the time you reach over to shut off that alarm, they're already surging. Those 2 hormones do 3 things to your heart almost simultaneously. Your heart rate climbs, your blood pressure rises, your blood vessels tighten, all of it within seconds. When you were 35, your cardiovascular system handled that surge without skipping a beat. The vessel walls were flexible. The system adapted instantly. But past 60, the picture looks very different. The arteries are stiffer, the response is slower, and in many people who feel completely healthy, there is plaque quietly building inside those vessels. Plaque they have no idea is there. When that hormonal wave strikes a vessel wall carrying vulnerable plaque, the force can cause it to crack. A cracked plaque triggers clotting. A clot in a coronary artery is a heart attack. A clot in a cerebral artery is a stroke. That isn't a worst-case scenario. That is the mechanism. That is what I have witnessed on the operating table more times than I can count. This is precisely why studies published in the American Heart Journal show that heart attacks are 40% more likely to occur between 6 and 10 in the morning than at any other point in the day. It isn't random, it's biology. And what you do in the 25 seconds after your alarm goes off either helps your heart manage that surge or pushes it over the edge. I want to tell you about a patient I'll call Douglas. Douglas was 68, a retired school principal, a careful, disciplined man. He took his blood pressure medication every morning without fail, walked 30 minutes 5 days a week, and kept his annual checkups like clockwork. His last cardiogram was clean. His doctor told him he was in great shape for his age. One Tuesday morning, Douglas woke up, silenced his alarm, and did exactly what he had done every morning for 15 years. He sat up fast, swung his legs off the bed, and stood up immediately. He took 3 steps toward the bathroom, and that was as far as he got. His wife found him on the floor. When I reviewed Douglas's case afterward, everything about his cardiovascular profile pointed to a man managing his health responsibly. His medications were correct, his diet was reasonable, his fitness was above average for his age. But no one had ever talked to him about the 25 seconds. We'll come back to Douglas because what came out of the recovery room conversation, the one change his cardiologist had never once mentioned, is the entire reason I'm putting this out today. Here is the habit. The one specific thing most people over 60 do every single morning that silently loads the gun. They stand up immediately. That's it. Alarm goes off. Vertical in under 3 seconds. It feels like nothing. It looks completely ordinary. And for your heart, at that precise moment in the morning, it is one of the most dangerous things you can do. Here's the science. When you're lying flat, blood is distributed relatively evenly throughout your body. The moment you stand, gravity pulls a significant volume of blood downward, toward your legs and abdomen. Your heart must respond instantly to keep adequate blood pressure reaching the brain. In a younger person, that reflex is fast and accurate. The vessels tighten, the heart rate adjusts, pressure stabilizes within seconds. In adults over 60, that reflex slows down. The vessels don't respond as quickly. Blood pressure can fall 15, 20, sometimes 30 points within seconds of standing. Doctors call this orthostatic hypotension. You may know it as that gray, dizzy, foggy sensation when you first get up in the morning. Many people over 60 experience it and chalk it up to normal aging. It is not normal. It is a warning. And here is where it connects directly to the hormonal surge we just covered. When blood pressure drops sharply after standing, the heart compensates, spiking its rate and output aggressively to restore circulation. In a vulnerable heart already under hormonal stress from the morning cortisol wave, already working against stiffer arteries and thicker blood, that compensatory spike can trigger an arrhythmia. It can fracture a plaque. In the worst cases, it can send someone straight to my table. Standing up in under 3 seconds is the 25-second mistake, and it costs absolutely nothing to fix. There's a second reason the morning is uniquely dangerous, and this one catches almost every patient off guard. After 7 or 8 hours of sleep, you are dehydrated. Every single morning, without exception. You haven't had a drop of water all night. You've been breathing steadily for hours, which continuously draws out moisture. The result? By the time your alarm goes off, your blood is measurably thicker and more viscous than it was when you fell asleep. Think of your heart as a pump and your blood vessels as pipes. When the fluid moving through those pipes is thin and flowing freely, the pump works with ease. When the fluid thickens, the pump has to push harder with every single beat. And thicker blood doesn't just raise the workload, it clots more readily. Research confirms that clotting factors reach their peak activity levels in the early morning hours. This is one of the main reasons strokes and heart attacks cluster so heavily in that 6 to 10 a.m. window. It's the hormonal surge combined with thick blood combined with stiff vessels, all colliding at the same moment. A triple threat for any heart over 60. The fix is almost embarrassingly simple. A glass of water, room temperature, before anything else. Before your coffee, before your medication, before you check your phone. 1 glass of water, taken before your feet touch the floor, begins thinning the blood, lowering clotting risk, and giving your cardiovascular system something to work with before the full weight of the day begins. This is the protective habit I mentioned at the top of this video. The one that JAMA research found reduced early morning cardiac events by up to 62% in adults over 60. 1 glass of water, taken lying down or sitting before standing, that's it. And almost no one does it consistently. Quick question before we go further. Do you drink water first thing in the morning? Before coffee? Before anything else? Drop a yes or no in the comments right now. I read every single one, and the pattern I see in those answers tells me a great deal about what information is actually reaching the people who need it most. Now let me walk you through the complete morning protocol. Because once you understand the danger, the solution is entirely straightforward. I call it the 90-second heart protocol. No equipment, no cost, nothing to purchase. Just a sequence that takes 90 seconds and protects your heart every single morning. Step 1. The moment your alarm goes off, don't move. Stay exactly where you are. Take 3 slow, deep breaths before you do anything else. In through the nose, out through the mouth, fully and deliberately. This single action activates the parasympathetic nervous system, the calming branch, and begins to counteract the cortisol surge before it peaks. 3 breaths, 15 seconds. One of the most powerful cardiovascular protective tools available, and it is completely free. This is your 25-second intervention. Not dramatic, not complicated. But the research on slow, deliberate breathing immediately upon waking shows measurable reductions in morning blood pressure spikes in adults over 60. Step 2. Drink the water before you stand. Keep a full glass of water on your nightstand tonight. Before your feet touch the floor, drink it. Room temperature, the whole glass. This is non-negotiable. You now understand why. Thin the blood. Reduce clotting risk. Give the pump better fluid to work with before the day begins. Step 3. Sit before you stand. Roll to your side. Push yourself up slowly. Sit on the edge of the bed with your feet hanging down. Don't rush. Rotate your ankles in slow circles, 5 times in each direction. This activates the muscle pump in your calves, which pushes pooled blood back up toward the heart and helps blood pressure restore itself gradually. Sit for a full 30 seconds before you stand, then rise slowly, pressing through your legs. Stand still for 10 seconds before you take your first step. That is the complete protocol. 3 breaths, 1 glass of water, sit before you stand, 90 seconds total, starting tomorrow morning. If you are currently taking a diuretic, a water pill for blood pressure, there is one additional thing you need to hear. Diuretics work by flushing excess fluid from the body through the kidneys. They are effective and widely prescribed. But when the kidneys flush fluid, they also flush magnesium. And magnesium regulates the electrical signals that control your heartbeat. When magnesium levels drop quietly, which they do in a significant number of people on long-term diuretics, the heart becomes electrically unstable. Palpitations, erratic rhythm, arrhythmia. And it tends to surface hardest in the morning, precisely when the heart is already under the greatest strain. If you're on a diuretic, ask your doctor at your next appointment to check your magnesium level, a simple blood test. That piece of information could be genuinely critical for your heart. I promised I'd come back to Douglas in the recovery room. After he had stabilized, I sat with him and his wife, and we went through his morning routine. He described it exactly as I had expected. Alarm, immediate movement, straight to vertical, straight to the bathroom, every morning for 15 years. Nobody had ever questioned it. His previous cardiologist had reviewed his medications, his diet, his exercise habits. Nobody had ever asked about the 25 seconds. We made one change before he went home, a glass of water on the nightstand, the 3-breath rule, sitting on the edge of the bed before standing. 6 months later, he came back for his follow-up. His morning blood pressure readings, which his wife had been tracking at home, had stabilized significantly. The dizziness he had always dismissed as a normal part of aging was gone. His cardiologist had noticed the improvement and asked what had changed. Douglas told him, "I stopped standing up fast." "Why didn't anyone tell me this sooner?" He asked me that in the corridor. I didn't have a satisfying answer, but I told him what I'll tell you now. The information exists, the research exists, and the habit itself costs nothing and takes 90 seconds. It simply needs to reach the right people before the morning it matters most. You are that person, and now you have it. Let's bring it all together. The morning is the most dangerous window of the day for your heart after 60. Cortisol and adrenaline surge before you're fully awake, driving up heart rate, blood pressure, and vessel constriction all at once. Your blood is at its thickest, your arteries are at their stiffest, and the habit of standing up immediately, something the vast majority of people do without a second thought, adds a sudden pressure drop that forces an already taxed heart to compensate aggressively. The fix is 3 steps. 3 breaths before you move. 1 glass of water before you stand. Sit on the edge of the bed for 30 seconds before rising slowly. That is your 90-second heart protocol, starting tomorrow morning. Here's what I'm asking you to do today. Put a glass of water on your nightstand tonight, just that one thing. The rest will follow naturally. Which part of this surprised you most? Tell me in the comments. I read every one. And if this gave you something you genuinely needed, share it. There is someone in your life who wakes up every morning doing exactly what Douglas did. You may not know who it is yet, but this video might be the thing that reaches them before the morning that matters. If you haven't subscribed yet, please do. Every week I bring you honest, research-grounded information about what your body needs after 60. The information I wish every patient had before they ever ended up sitting across from me. Take care of your heart. It has been working for you every single minute of every single day without ever asking for anything in return. Give it 90 good seconds tomorrow morning. It is more than a fair trade. Disclaimer: everything shared in this video is general medical information based on published research and clinical experience. It is not a substitute for your personal medical care. Before making any changes to your medications, exercise habits, or morning routine, please consult your own physician first. They know your history. Bring this information to that conversation. That is exactly where good medicine begins.